Greetings, class. The core value for Nursing 452 is advocacy. So, advocacy is defined by Merriam-Webster Dictionary as the act or process of supporting a cause or proposal, the act or process of advocating something. So, the American Nurses Association, or the ANA, has this to say. The ANA believes that advocacy is a pillar of nursing. Nurses instinctively advocate for their patients in their workplaces and in their communities, but legislative and political advocacy is no less important to advancing the profession and patient care. So, advocacy has a huge impact on nursing care, and it encompasses many of the other core values that we have discussed throughout this entire program, really. So, Hawaii Pacific University developed some examples of advocating at the patient level and at the organizational level. So, advocating at the patient level includes giving patients a voice, educating patients, protecting patients' rights, reviewing for errors, and connecting patients to the resources that they need. So, at the organizational level, it involves arranging patient care conferences, requesting ethics consultations, serving on an ethics committee, and working with nurse mentors. Now, obviously, these are just a few examples, but I thought that they were helpful. So, advocacy seems like an easy concept to grasp, but in reality, sometimes it can be very difficult. So, there are times where nurses are faced with situations where making the right decision for their patients may make someone else upset, such as a family member or even that patient's physician. And in these moments, it is important to remember that advocating for a patient is the priority, and they deserve autonomy and they deserve excellent care from, their hospital staff. A good nurse advocate will utilize the interdisciplinary team when providing care. For example, consulting case management when your patient needs set up with outpatient therapy, or contacting the hospital chaplain if your patient wishes to, pray before they go to surgery. Nurses are not the only healthcare profession expected to promote advocacy, but it is a pillar for us. So, in recent news, a nurse named Redonda Vaught was found guilty of criminally negligent homicide after she gave a fatal dose of a medication to a patient, which actually wasn't even her patient at the time. She immediately took all the steps in reporting this error, and she took responsibility for the action. Many nurses have recently voiced fear over what this case could mean for the nursing profession and for patient safety. This nurse, besides the error, did everything, the way that she was supposed to. Could this make nurses less likely to report errors when they occur? That's one fear that I and many other nurses have. From an organizational level and even a patient level, reporting errors is a way that we advocate for our patients because it helps us make improvements and identify deficiencies where they lie. So, as the American Nurses Association said, legislative and political advocacy is no less important to advancing the profession and patient care. So, nurses should be fighting for the protection of those who do the right thing, and they should continue fighting for their patients as well. Thank you for listening to my discussion post on the nursing core value of advocacy. I look forward to hearing the thoughts of the rest of my classmates.